Kia ora koutou katoa. Today I'll be providing an update on the traffic light settings and the work being done to prepare for an outbreak of the Omicron variant of COVID-19 in New Zealand. Yesterday afternoon, ministers met to discuss the traffic light settings throughout the country. Following public health advice, Northland will join the rest of the country in orange at 11:59 p.m. tonight. The rest of the country will remain at orange. Vaccination rates have continued to increase in Northland, and they're now at 89% first dose and 86% second. In addition, the easing of the Auckland boundary over summer has not driven an increase in cases in the Northland region. In fact, the changes in boundary have not caused an escalation in cases anywhere in the country. This has been as a result of three things: exceptional vaccination rates, our public health teams continuing to stamp out cases when they find them, and the COVID protection framework working as intended. All have come together to reduce the spread of Delta and leave us in one of the best positions in the world to fight Omicron. That then brings me to the challenge of Omicron. This stage of the pandemic is different to what we have dealt with before. Omicron is more transmissible. That is going to make it harder to keep it out, but it will also make it more challenging to control once it arrives. But just like before, when COVID changes, we change. And we are in a solid position to do that. We have the data and evidence from the experience of other countries to make the best decisions we can based on what we are seeing elsewhere. And what we are seeing is that for most people, Omicron will be a manageable illness, but not for everyone. Some people will need hospital-level care. That's why our strategy continues to be to minimise and protect. That means we won't stop Omicron, but we can try and slow it down so that rather than dealing with a tidal wave of cases, we work hard to keep cases as low as possible so our health system can manage and provide the care that people need. To slow it down, we need to be on guard and ready. And that is why we will remain in orange. We continue to work hard to keep Omicron out of New Zealand, and we've caught a number of cases at the border. We're using our tried and true methods of maintaining high levels of testing, of contact tracing and isolation to prevent it taking hold in the community. But as in the past, we may not know initially when COVID has moved beyond our border into the community. But orange helps provide some protection when it does. And in the early stages, this will be important. Once Omicron arrives, though, we will need to step up further. That's why I'm confirming today that when Omicron enters into the community, beyond border-related cases, the whole country will move into red within 24 to 48 hours. We know from other countries that Omicron can take as little as 14 days for cases to grow from the hundreds into the thousands across the country. It is important to remember, though, that red does not mean lockdowns or regional boundaries, and business remains open. What it does mean is immediately increasing our use of masks, changing the way we interact in hospitality, and reducing gathering sizes in order to slow Omicron down. But getting our public health settings right are not the only things that we can do to prepare. We can also vaccinate. This week, 5 to 11-year-olds became eligible for vaccines, and importantly, everyone who's had their second dose of the vaccine 4 or more months ago can now receive their booster. The evidence tells us that while 2 doses of the vaccine makes a huge difference for the Delta variant, it's the booster that will help get us through Omicron. And it will help us in critical ways. While many people who become infected with Omicron will not get critically unwell, others will. The boosters reduce the severity of illness. It means you're much less likely to end up in hospital than if you don't receive a booster. And that will be so important in making sure our system can manage what comes our way. Not many countries have had the chance to roll out a booster before Omicron hits. We have, and we are. It's an opportunity we need everyone to take up. These are the things we can do to prepare, but there's also things that you can do as a whānau. Just like before, anyone who is a close contact of a COVID case will need to isolate, and obviously if you get Omicron, you'll need to be at home for a period of time. We're working hard to make sure people who may need support through this period, be it from healthcare or social services, have what they need. But for the most part, people will be able to support themselves. So we're asking that you think about what you'll need to stay at home for a period of time if you or a family member is infected with Omicron. And while you prepare, these are the things we're doing to make sure we are ready for what we've seen abroad. Omicron's high transmissibility has seen large case numbers internationally. While we're better placed than most countries to minimise the spread of Omicron, we will have higher case numbers than we're used to seeing or have experienced before. That volume of cases, but also the fact it is a less severe illness for most, means we will manage cases differently and focus on reaching those who are the most vulnerable. We are preparing a graduated system for case management for different stages of the pandemic. We're also doing work to ensure that essential services are able to continue operating in a high transmission environment by using more frequent testing. There are examples where we already use regular testing in this way in our healthcare settings, and we're looking to expand these protocols. Currently we use PCR testing as our primary way of identifying cases. We have the capacity to undertake 40,000 tests a day without any strain on our system. We know that with wider spread, this system will need to change though. Here, Cabinet has already established several principles for testing in the future. They'll be focused on those who are symptomatic, vulnerable, essential workers and close contacts. They will be free. I repeat, testing in New Zealand for COVID-19 will be free. They will be available locally. Rapid antigen tests will be used more widely. They perform best when rates of COVID are high, such as during the peaks of transmission other countries have experienced with Omicron. Currently we have 4.6 million rapid antigen tests in the country and tens of millions of rapid antigen tests on order. With this number, we can maintain our testing principles. To summarise though, every day without Omicron here is a day we can continue to prepare, but we need your help. This is going to require a team effort, just as it has at every other stage. We need everyone to think about how they can prepare. For families, make sure your vaccines are up to date and everyone who is eligible is boosted. Think about what you need at home if you're required to isolate. Business, think about PPE and distancing in your workplace, as well as how you can support your workforce to get a booster. Think about contingency planning should parts of your workforce need to stay at home. And familiarise yourself with the Leave Support Scheme that gives financial support while people are isolating. But to everyone, we've experienced large change in this pandemic before, and we are on the cusp of that again. But we don't need to be fearful. We do, however, need to prepare. We're well placed to take on this next challenge because we've always put the important things first, and that ultimately is one another. We're now happy to take questions.
What's the plan for hospitals?
Jason and then Mikey.
What's the plan for hospitals if they're overwhelmed? Can we expect more information on that?
Well, first and foremost, our plan is very much focused on taking a preventative stance. We know that we will not be able to stop Omicron from spreading given the infectiousness of it, but we can slow it down. And by working to slow it down, we thereby support our health system to cope with what comes our way. The booster is also critical. At the same time, of course, we've had in train, even since the Delta wave, plans to support, and those are already in place, to support our healthcare system should we see increases
So
in
there's
cases.
nothing additional that the government's going to be doing?
That work was already done with Delta. We were preparing at that point for a disease that had even greater severity and even greater likelihood of a hospital transmission. So ICU surge capacity, bringing in additional health workforce, creating space in negative pressure rooms. That's work that was already underway and continues.
So hospitals won't be overrun by Omicron?
What we have to do is make sure we take the steps to prevent that. Get boosted and try and slow it down. And I've outlined today the ways that we're looking to do that.
In terms of the preparation window that you're talking about, in terms of delays, in terms of opening borders and so on, how long do you expect that will be?
Well, of course, what I've talked today about are the things that we need to do now. We've already seen we have cases knocking at our door. We've had cases obviously increase at the border, and we've had examples of our managed isolation workers who, because of how infectious Omicron is, have contracted it. Now, we've picked them up, but it is, of course, a case of when, not if. So that's why we need to use every day to prepare. Now, government is doing that. We're asking the public to help as well.
Prime Minister, you said earlier
I'll come here, Claire, and then down the back.
You said earlier this morning that widespread lockdowns shouldn't be needed with our current vaccination levels and under the framework. Does that mean under what circumstances would, say, smaller or localised lockdowns be used?
We've always said with the COVID protection framework, lockdowns aren't built into that system. First and foremost, we use public health measures, social distancing, mask use and gathering limits, and that remains the case. But the COVID protection framework's always had the ability, should we need localised lockdowns, and what we include there is, should we need to see, for instance, workplaces, or in specific circumstances, education facilities. We've also said if we have areas, for instance, that may be rural and isolated with very low vaccination rates, but it is not at its core part of the blanket COVID protection framework.
So not entire cities or regions?
No, that is not part of the COVID protection
so a town
framework.
like Murupara wouldn't go into lockdown. A small town like Murupara, with, if they had
The
low
COVID
vaccination
protection
rates.
framework does not have at its core lockdowns as a way of operating, and that's because we're in a different environment. We have vaccines to support us. We have other mechanisms to try and slow Omicron down, and we are using those. But lockdowns are not part of our core toolkit.
So you mentioned
they are in reserves if our advisors and our experts advise us that in certain areas that they may have a use, but you won't see them used in the way that you saw them used in 2020 and 2021. Not in the same way.
So we'll never see the Auckland boundary again?
That is not part of, we don't have regional boundaries as part of the COVID protection framework. And look, with Omicron, it is demonstrating the pace at which it moves. So we are better, of course, to focus our energy on the things that we know will make a meaningful difference. Mask use, social distancing, reducing gathering sizes, and those are all things that are included in our red settings. We will move when Omicron arrives.
Have you seen any modelling any modelling on how bad it's going to be, how many cases we could see when Omicron gets
I think the first thing to say is that Omicron is markedly different. On the downside, yes, it is more infectious. On the upside, of course, it is for most people a mild to moderate illness that they will be able to care for themselves at home, particularly, of course, if they've been vaccinated and boosted. We have to prepare ourselves for every circumstance, though. We want to take a preventative stance by slowing it down, because at the moment the modelling is highly variable, and at present it is just too difficult to say what we may see in New Zealand. It varies from the thousands to the tens of thousands.
And moving the country into red is not what a lot of people wanted to see from this announcement. They wanted to see a detailed plan of how supply chains will stay open. What happens to close contact when we don't have labour shortages? Where is the plan for Omicron?
Well, the first thing I would say is that the COVID protection framework is a core part of our preventative stance. Then, of course, there's the work around the way case management works, isolation and contact tracing, and as I've said, ensuring business continuity. We already have in place a system that has served us well. What we will be presenting is a graduated system that, as we see Omicron in our community change, we'll move through those graduated settings. We'll be looking to share that as early as next week. the business continuity work is already underway. MBIE's working with those sectors that are essential workforces to ensure that we have measures that allow food distribution, healthcare to continue to be provided through a period of Omicron being in the community at high rates.
Does that mean that close contacts or people who would normally have to self-isolate, will they be asked or required to go to work as a special group?
Yeah, and as I say, look, we're working on a graduated system. So long as we're able to maintain the way of working that we have, we'll continue to do that. But when you look overseas, you can see that changes quite rapidly, and with Omicron being a different disease, that gives us the ability to actually adapt to. So we'll be presenting that graduated system in the coming days. I'll come Joe, and then I'll come over here. Yeah.
You said that the booster shots and getting kids vaccinated is a big part of the preparedness before it arrives.
Particularly boosters.
What modelling have you seen around how long it might take to get that done, and does that ultimately mean that the border, which is obviously a big tap you can use, needs to stay shut in the way that it now is until you get to that point?
By the end of February, 82% of New Zealanders will have been eligible for their booster. So we do know that a large portion of the population will be eligible to have received that booster shot. We know that roughly 52% of those who are eligible now have received their booster. We need those numbers to increase. And so that it has to be a core part of our preparation strategy. Now, not many countries are in the position to vaccinate before Omicron arrives. We need to use that advantage, get boosted and be prepared.
So what connection does that
In
have
terms
to
of the border, look, I think the point I would make is that every day that we don't have Omicron in our community now, we need to use. So yes, we've signalled that our intention was for the end of February to see changes at our border. Omicron is already knocking at our door though, so we need to move now. No one should be waiting for border changes to go out and get boosted. They should do it now.
And you've indicated in that answer before that it's a little bit slower in terms of the booster uptake. So
The numbers obviously demonstrate, but equally I remain optimistic. New Zealanders are returning from their summer holidays. We're seeing people being boosted as they bring in their kids for vaccines. What I want to see is those numbers continue to increase.
My question on that though was, if so many 82% or whatever are eligible by end of Feb, but if it's sort of going to be end of March, end of April, if that's what the modelling's looking like, then are you going to hold up everything until you get to that point?
Cabinet's made no such decisions on that.
You said this morning that this year we will see case numbers that we haven't seen before.
Correct.
How many cases a day are we going to see?
As I've seen, the modelling that I've seen, and I'll leave it to those modellers to release their numbers, but the modelling I've seen is highly variable, from the thousands to the tens of thousands. And I think that just demonstrates that we're watching Omicron having only entered into the world's awareness in November. So it's very difficult to predict the impact that preventative measures like our red settings will have, the impact of boosters and a pre-boosted population will have. So it is difficult to model. We know enough to know though that boosters are really important, and making sure we move quickly is really important.
Can you tell us about this possible Omicron case in Palmerston North?
Yeah.
Is it possible that we could see a move for the entire country to red in the next?
So look, as I've said, what we're looking for is once it's moved beyond border cases, we have seen a handful now of border cases, and for the most part we're seeing that actually we've got those quite early. The Palmerston North case, you'll have seen all of the details already released from the Ministry of Health. This is an individual who was tested 5 times whilst in MIQ, stayed for a full 10 days and was released after their final negative test. Several days after being released, they've become symptomatic. The same day they became symptomatic, they were tested, returned a positive test. Their family household contacts are in isolation, and they are also contact tracing secondary contacts as a precautionary approach. We have, as yet, no returned tests for their household contacts, but as soon as we do, you'll see us report on
Is
those.
it possible that they may have picked it up in the community instead?
No, that is not the assumption that we're working to at the moment. We don't have whole genome sequencing, but we do know that there were 5 other active cases on the floor of this individual while they were in MIQ. The Ministry of Health is actively, as they do in every case, working to establish what may have happened here. Whole genome sequencing will support that, but they are acting on the assumption that it's Omicron and that it's come from their period in MIQ.
Do you think that the border...
I'll just debate if you don't
Thank you. Can I ask for your reflection on the Australian case numbers, the hospitalisations, the deaths, Victoria's Code Brown, all of this, does that come into your thinking as to why you've made the calls today?
It's fair to say that we are looking at the circumstances of every country facing the wave of Omicron because we need to learn from that. And we are learning from that. There's interesting research being produced by the likes of Denmark around the impact of boosters. They have a relatively high rate of boosters. We're looking at Singapore, we're looking at Australia. What I would say about Australia is I'm not sure that we can directly make a comparison. We've been very deliberate that we do want to preventatively move and move very swiftly with public health restrictions to help us. And so that may put us in a different position, but it is hard for us to fully assess the impact of taking that stance. I'm tending to look a bit more at South Australia and what they're experiencing, more so than, say, the likes of Victoria and New South Wales. They had a lot of seeding, and they had a lot of seeding from the border.
Can I also ask, with the arrival of Omicron, is it a fair characterisation to say that's when New Zealand will shift to a mitigation strategy rather than elimination or...
You've heard me say Omicron makes a strategy of elimination nigh on impossible. But that does not mean the challenge of Omicron we can't take on in our own way and in a way that continues to protect people's lives. We have more tools now than we've ever had before, and we are going to use all of them. I think that
mitigation, though, isn't it?
Yeah, so we've expressed it as a minimise and protect. So use the tools we have to minimise the impacts as much as we can and protect our population as much as we can. And so you'll see as we release the details around using the most up-to-date data and analysis of how we're looking to operate, that top of mind will continue to be protecting people's lives.
Does that mean that the border is one of those tools and that you couldn't really open the border until the Omicron wave had gone through?
No, look, as I've said, we have made no decisions to change the border, so I'm not going to speak to a hypothetical there. But you can see the difference that the border has made to date, which has allowed us this time to prepare. But what we are all very realistic about is that it is giving us time. It is not indefinite. It is knocking on our door. We need to use the time wisely, and we all need to use that time.
Given what you said about elimination being nigh on impossible, given what we've seen in other countries with this variant, have you got a time limit, as in what the maximum amount of time you're willing to let the country stay at red for before you just say we have to move it down?
Yeah, so that is a good question. We have had conversations around that. So we'll be moving it into it quickly because Omicron will move so quickly. I think if you waited for your health system to be pressured, then that's too late. You need to get in beforehand. And I think people appreciate that. And we've seen that from the rapid transmission, a 14 to 19 day window before people are seeing the full brunt of Omicron overseas. In terms of moving out, we would then use the measures that we already have in the framework. So assessing the impact, whether or not our hospital system is coping well, our services are coping well, that we're able to provide the healthcare we need. That will be the assessment for moving out of those settings.
And could New Zealand ever see a situation where any region is in the green level while Omicron's still in the community?
Look, initially, of course, because of the high movement of New Zealanders and the high transmissibility of Omicron, it makes sense for us to take an all of New Zealand approach. What we'll need to assess is what then the exit looks like.
And
then I'll come to you.
End of February, just to clarify, end of February, is that when we're expecting restrictions to ease at the border?
No, so just all I'm saying here is that the status quo decisions that have already been made, Cabinet has not made any decisions to overturn what has already been said there. So it's just the status quo at the moment. We've had no discussions around changing.
So that was
We've had no decisions around changing.
That was the end of Feb sitting, and in your comments before you said there'd been no changes at the border. I'm just interested in whether you think that
what I'm referring to obviously is we haven't in Cabinet made changes from what we said last year.
But in terms of the public, do you think that those who had hoped to come home and have MIQ ballots available for that March-April period would see it that way? Because there's no way home for some people at the moment.
What was announced by Minister Jacinda yesterday was not that people are unable to return. Of course, we have people continuing to return, but whether or not there's additional vouchers being released. We know people are in for 10 days. We have more cases. That, of course, means people are staying longer, and, of course, that puts pressure on the system. I'll let Minister Hipkins speak to that, but I think probably we're just repeating what we said yesterday.
It is really important to note that the vouchers we're talking about are for March and for April, not for January and February. So we have put a pause on the release of additional vouchers for March and for April. That's not to say that there won't be vouchers released for March and for April. They're just not being released yet.
I guess what I'm saying is that there is, people feel uncertainty naturally in a time like this. And when a ballot that is for a 2-month period of time disappears on them and there's no new information, can you see that people would see it as no way home for them?
I think what people want to know is whether, in fact, they will need to go into MIQ when they come home, if they're hoping to come home in March or April. And at this point, we haven't got a very clear answer for that. As we indicated before Christmas, we've been planning towards an end of February start date for home isolation. We haven't made decisions to change that. So at the moment, we want to provide people as much certainty and clarity as we can, but it is still a very uncertain time. Obviously, Omicron has changed the situation to what we were dealing with even 3 months ago.
So what's the situation with rapid antigen tests in terms of distributing them and making sure people have them on hand at home for free so they can use them as they go?
So I'll make a very quick statement. First of all, you will have heard us talk about the graduated system. And the reason we're talking about that is initially when you have lower case numbers, there's good reason to keep operating the way that we are. We know that PCR tests are more accurate. We've got capacity for 40,000 a day. But at the same time, we're preparing to introduce rapid antigen tests much more widely into our system. That's why, of course, we have the already 4.5 million in the country and tens of millions on order. And working on a distribution model that means that people will be able to access them locally. Again, part of the graduated system we'll be sharing details on next week will include the way that those will be distributed.
System of rationing, at least in the first instance.
I wouldn't describe it in that way. You will have heard us say that we want to make sure that close contacts, symptomatic individuals, those who are in essential work and who are part of the critical supply chain and those who are vulnerable, a core part. Keep in mind, of course, rapid antigen tests are already able to be accessed privately. Encourage businesses as part of their contingency planning where they are wanting to ensure continuity to access those rapid antigens and hold them in stock themselves, and many already have.
So will they be free as well, because some other countries are giving them out for free?
So we're making sure that we are providing rapid antigen tests to the community for free. If a business is providing them for their staff, I imagine they would do the same.
Why is the detail around close contacts and testing for Omicron still being worked through? Why don't you have that detail today?
Well, we do, but we're providing information in a staged way. Well, to be fair though, of course, the initial stage of Omicron will be as it is now. What we're talking about is the stages when we have higher case levels, and the graduated system will apply when we come to those higher case levels.
But if you have the detail around close contact definition, testing, procedures in terms of Omicron,
for the most
why
part,
won't you release that today?
For the most part, there are some final details. Of course, we are working through.
So you either have it or you don't.
We have a broad plan, yes. We have a graduated system, yes. But we'll be providing the finalised detail of that next week, and it also gives a chance for it to be presented in full to Cabinet. No, not at all. Hi, Ben.
The Kiwis need to have a bit of a personal reckoning at this point and sort of accept that if Omicron does come, they might get COVID, and the likelihood is they'll be fine.
We'll hear that is much of what we're sharing today. And keep in mind, we have a system that already supports people to be cared for at home. We already have a contact tracing system that we will use for Omicron. We already have an isolation system we will use for Omicron. We have a social service support network we'll use for Omicron. We have it all in place. What we're ensuring is that it will be fit for purpose at higher levels of caseload, and that we'll be making sure we're still reaching those who need that extra support. Most people won't, though.
What I'm talking about, though, is not necessarily the preparedness, but the mindset shift that Kevin's taking.
Yeah, and look, this is why you'll hear us talking about what we're seeing of other countries, talking about what we expect, talking about what we're seeing in the evidence and the data. And that's because that is what most people are experiencing. We're also not downplaying the need to ensure that people take this very seriously. a booster is critical to ensure that you don't have that severity of illness. So we've got to get that balance right. It is different to Delta, but we do still need people to be prepared.
Prime Minister, just back on the hospitals.
Amelia.
Why is it taking so long to get that detail of the close contact definitions, for example?
As I've
we
said,
had Omicron at our border a month ago.
it hasn't. The close contact definitions and the definitions we're using haven't changed. But we are going to cast forward and look at situations where we will have higher caseload. And as I say, within the next 6 days, share when we reach those high caseload numbers what people would expect to see change in that system. And so that will be well in time before we're ever likely to have needed those, well in advance. Many other countries are providing that once they hit them. We will be much more in advance of that hitting New Zealand.
Prime Minister, just back on the hospitals question, are you comfortable that everything is being done to prepare hospitals for Omicron? I mean, we're hearing stories about overworked staff in hospitals, EDs.
Well, given we don't, I mean, you're asking me whether or not we've done the preparedness work, and of course, we have been preparing our health staff for Delta waves and now, of course, Omicron waves. What we're doing is trying to draw on the international experience of our counterparts. We have within the Ministry of Health almost daily contact with counterparts in Australia. I was just reading a readout today on some of their experience, and much of what they're sharing is around the management at home, because when those settings are right, you see less pressure on your health system. But we also are going to do things our way, and that means taking a preventative approach. I'll take last question.
A document leaked to Māori television states that Omicron outbreak will swamp the country's health system and elude the precautionary measures which have prevented COVID-19 transmission so far. The preparations for Omicron that you've talked about here, are they enough?
Well, as we've said, they're preventative and they are about slowing the spread of Omicron down. But no one, I think, is standing here today telling you it will be that it will be possible to stop it entirely. No country in the world has been able to do that. We are asking people to help us by being boosted, by preparing yourself. We, in turn, will make sure that we've got social services ready, we've got healthcare provision ready, and that whatever comes our way, we're on the best possible foot. And already we are better than, far more prepared than many other countries.
You talked this morning about the other issues.
I did say last, and I am being a little generous over here coming to
this morning, but you talked this morning about the other issues that the government will look at, climate change over the next year. Realistically, how is the government going to do that with the disruption that Omicron sounds like it?
We already have. I mean, you've already seen us establish those really critical mechanisms that we need, increase our ambition, the emissions reduction plans we've been working on throughout COVID. And as I said this morning, Labour as a government has not only been tackling head-on COVID and has been one of the most successful countries in the OECD in doing that, we've also been taking on the other challenges that New Zealand faces. We are the party, I believe, that takes on challenge and change well. We need to keep demonstrating that.
Will there be some kind of financial support or wage subsidy that continues for businesses?
Yeah, so
also, what are you going to call the year of 2022?
I'll let you pick a name. In terms of support, the leave support scheme, the 7-day payment that mirrors the levels of the wage subsidy, I think will be critical for Omicron, and that remains in place. It provides financial support while employees are isolating or if they indeed have the illness themselves. We do continue to keep an eye on whether or not additional sector-specific support is required, and we continue to assess whether that will be needed in the next stage. All right, I'm going to wrap now, everyone. Thank you.